Today, I wanted to discuss what pelvic floor physical therapy actually entails. So, hey, it's Dr. Kayla Borchers. I am an orthopedic and pelvic floor specialist. So, what this means is I have advanced training in both, and I think this gives me a unique lens to speak to this conversation. So, backtracking to when I worked in the traditional medical setting, I was in a sports medicine clinic. I worked primarily with orthopedic based injuries or sports related injuries. And the pelvis was just this piece of the puzzle that was ignored. And so when I started raising questions to ask about if patients were leaking when they were running, for instance, they would be seeing me for hip pain or back pain, and they were, let's say, 12 months postpartum. So I may ask the patient, are you having any other symptoms when you run? Like, are you leaking, like any pee when you run? And they would most often be saying, yes, I am. Nobody's ever asked me that question before. Or maybe they had a C-section and I would inquire if their C-section scar had ever been worked on. And the patient would often say, no, it hasn't. I was never referred to physical therapy for that. My back just hurts or my hips just hurt. So I came in for this. And so when we started to look at the full picture of the patients that I was seeing, the pelvis had repeatedly been a component that was ignored. And so that's why I started getting into pelvic floor physical therapy. I started taking extra training that taught me how to evaluate and assess the pelvic floor of the orthopedic patients that I was seeing. And so when I first started treating the pelvic floor, the initial evaluation really didn't look much different than a regular orthopedic evaluation, except for the fact that I was pulling in the pelvic floor as well. So let's get back to that initial question. What does pelvic floor physical therapy look like? So I'm going to talk you through what a typical evaluation and treatment session may look like with me here at my Holistically Well Physical Therapy private practice. We treat patients both in person and virtually, and you'll better understand what to expect and what that looks like through today's conversation. So, if you've ever been curious about what pelvic floor therapy really is, then keep listening. So, at the initial evaluation, we start with your subjective interview. And so you get to sit in a nice, comfy chair in our boutique physical therapy office or from the comfort of home if you're a virtual patient. And we talk about your symptoms. So, maybe you have issues peeing when you run. Maybe you get this really strong urge that you have to use the restroom and you have to use it right now. And you can't make it there, but you just had no urge beforehand. So maybe you get this strong urge to go and you just can't control it. We call this urge incontinence. Maybe you have pain with inserting a tampon or pain with intercourse. Maybe pain isn't your symptom. Maybe it's tension or this heaviness sensation, like you need to deliver a baby. There's like a baby head right there in your pelvic floor, but you're like, I'm not pregnant, or I shouldn't be pushing right now. I'm not in labor. That is a sign of prolapse. And that's something else that we would want to address as a pelvic floor physical therapist. Maybe you're coming in proactively. You're pregnant and you heard that pelvic floor physical therapy can help. Maybe you're postpartum and you tore during delivery or you had an episiotomy and you want to make sure everything is healing as it should before you end up developing any symptoms, right? So you're coming in proactively, but you've had an event such as pregnancy or childbirth that is making you think this may be a benefit for me. Maybe you're going through perimenopause or menopause and everything's just changing. You are having vaginal dryness, your joints just ache more than they ever used to, and you're not really sure where to turn. Or maybe you have orthopedic type pain, such as the hip or the back pain that I mentioned treating at the start of my career, but it's never healed. You've gone to multiple orthopedic specialists or sports medicine physical therapists to no avail, right? Nobody's been able to solve your pain point. Patient comes to mind that I just saw this week who is a collegiate runner and has had pain for a year and never improved with the orthopedic sports med PT she saw. It didn't improve after resting it for multiple months on end. The pain was constant, even at rest and with running. And in one session, we got her pain down to a 1 out of 10 at rest. And with all of the movements we did in the office today, no pain. So pelvic floor physical therapy can do a world of good for any of these ailments. And we start with that subjective interview to really understand what is going on for you. Is it pain? Is it tension? Is it heaviness? Is it urinary leakage? Is it a combination of multiple things? Or is it proactive in nature where you're not having any issues yet, but you've heard of family members or friends who do, and you want to avoid that for you? Then we take you over to the table. So we have a treatment table. You sit on that and we look at your strength, your mobility. It's called manual muscle testing. And we look at some mobility of your joints. And then we look at your alignment. So your rib cage angle, your pelvic alignment, your leg length. These are things I care about as a pelvic floor physical therapist because we will oftentimes find rotations in the pelvis. Tailbone pain or discomfort is another thing that sometimes comes up. And when that pelvis is rotated, it's putting more strain on one hip versus the other. It's shortening some muscles while over lengthening other muscles. And so if we're stretching and it's just making symptoms worse, or it's not really helping, or it's very short-term relief, we have to think, well, maybe that person's just not in alignment, right? Maybe we're stretching tight muscles that are trying to compensate for something that is out of alignment, right? So we want to restore alignment to the body and the skeleton. And then we want to relieve myofascial trigger points or areas of tension that continually pull that body out of alignment. And this is where physical therapy really differs from chiropractic care, where chiropractic care, you're going to get that manipulation to get the body back into alignment. Awesome, that's great. The nervous system is happy, the skeleton is happy, but you walk out that door, and if you're not changing what is continuing to put your body out of alignment, you're just gonna fall right back out of alignment, right? And so we work very well in parallel with patients who see a chiropractor because we can help you understand, well, why? Why do you keep going out of alignment, right? And how can we reduce those myofascial trigger points so that you stop going out of alignment? And then we take it off the table and we look at your posture. We look at the way you move. So maybe you're standing with a huge rib cage flare where your back is really arched and your rib cage is flared out. Your rib cage alignment is something else we just measured on the table, right? But then we look functionally how you're standing. Oh, you're always holding your baby and baby's up on your chest and you're arching your back. No wonder we're having back pain, right? No wonder our back muscles are so tight and locked down and our rib cage is flared because we can directly see what you're doing in your daily life that is contributing to that. And so part of your home exercise program would then be to also change these habits that we've developed over time so that we're not continually pulling our body out of alignment. And that's something we talk you through on a need-by-need basis, right? And then we're looking at the way you move. So the way you squat, the way you hip hinge maybe, and deadlift type motions. And all of this is patient specific. Now, everything I've described so far, other than that like manual overpressure, we can see on video quite well with our virtual patients too. And so that's why we can do pelvic floor physical therapy either in person in our office here in Sydney, Ohio, or we can meet virtually and we can be on a video call and see the way you move, hear what your questions and concerns are, and then based off of that, bring you through a variety of movements to better assess where you may be limited in mobility, where you may be weak, where you're painful, and then how we can intervene in a lifestyle component through that posture and movement screen. Now, we're gonna get more pelvic floor specific. So something externally I love to assess is breathing. This is with patients on visit 1, like we are always assessing the way you breathe. Initially, I have you lay down on your back, your knees are bent, one hand on your chest and one hand on your belly, and I just watch. So again, this might be in our office or this could be virtually. And I look at the way you breathe. What we often see in office is that people are breathing into their chest and they're kind of flaring their rib cage in the process. When you do that, you're using your accessory muscles a lot. And so that would be your scalenes, your upper traps. So you're kind of shrugging those shoulders up towards your ears. And so if you're somebody who struggles with headaches or just chronic tension in your neck and in your upper shoulders, we really want to look at the way you breathe. But this contributes to the pelvic floor Because we want that diaphragm to drop when you breathe. When that diaphragm drops, it creates this negative airflow pressure of air being able to travel right into your lungs without your muscles having to assist at all. The diaphragm muscle is really the only one that needs to be working with that nice, restful diaphragmatic breath. When your diaphragm drops, it should push all of your internal abdominal reproductive organs down into that pelvic bowl, and your pelvic floor muscles should lower and lengthen. And so by watching your breath, I can visibly see, and are we getting that breath all the way down into our lower belly, into our pelvic floor, or is it staying stuck up in our chest? If a patient is with me in person, I'm palpating. I ask, am I able to feel if that pelvic floor moves with your breath? And they'll either say, yes, they're comfortable with that, or no, they're not. And so we can feel if that pelvic floor moves down into my hand or not. I can also have patients assess for themselves. So maybe I'll give them the cue to place their hand there and see if they can breathe down into their own hand. Sometimes having that tactile overpressure or something to feel that downward pressure into can be very helpful. If you cannot feel that movement on your back, then I'll get you into a different position, again, in person or virtually. One of my favorite positions to get you in next would be a child's pose. So you're kneeling, you sink your hips back to your heels, you lay your chest over your thighs, arms reach overhead, and your forehead comes down to the floor. So now as you inhale, your chest and your belly is against your thighs. And so we're limited in how much expansion we can get in the front. So now we're forcing that air to the low back and to the glutes and down into the pelvic floor. And oftentimes patients can feel a lot more expansion that way. This gives me feedback as to what exercises I want to give you for home. And we start the treatment process right away. So in that initial first visit with myself or my team, we're not only evaluating, but we're also diving right into treatment. And that's the beauty of a private practice. We're working for you, not your insurance company. And so we don't have to make sure from what's called a documentation standpoint, we're checking all the boxes that an insurance company would want to know to approve or deny care. We get to look at, what do I, as the clinician, need to know in order to provide you with the best care possible. And so we're starting with that subjective conversation, really understanding your story. Then we're looking at those objective measures globally. I'm talking posture, alignment, breathing, and then strength in the hips and in the core especially. And then we're looking at those daily lifestyle factors that may be contributing to your recurrent pain or tension patterns. And then we dive right into treatment. We come up with a game plan in office to help getting you feeling better as soon as possible. And then you get an email from us outlining the home exercises that we want you to get started with. Now, everything I just described was external, right? When people think of pelvic floor physical therapy, they often think straight blinders on pelvic floor specifically. Now, are we able to do internal assessments in my clinic as well? Yes, we are. But that is typically not the very first thing that we dive into. Reason being, I want to look at the way you're living your life. I want to look at those global factors that are contributing to your pain, your discomfort, your tension, and address those kind of from that outside in. Now, are there cases where we do an internal assessment first visit? Yes, sometimes we'll have individuals come in. A patient comes to mind who I saw this week as well, who had a second-degree tear during childbirth and was having a lot of pain. Pain with sitting, pain with touch. When she was assessed at her 6-week postpartum visit, it was extremely painful. And so she knew she was having no other symptoms, no hip pain, back pain, nothing else going on. It was like localized pelvic floor, and this is my concern. And so we did an internal assessment at that very first visit. We were able to feel right where that scar tissue was. And in that first visit, we were able to do some gentle manual therapy, myofascial release of the scar tissue of where she had torn during delivery. She went from being in extreme pain to no pain in that very first visit. And I tell you that because the quicker we intervene with something like that, I mean, that's a beautiful example of her being very bodily aware. That same day, she had her 6-week midwife appointment and then came to see me pretty much right after. She had that pre-scheduled because she knew she wanted to do postpartum physical therapy. Initially, she thought, if I'm not having any pain, then it'll be something that's proactive. But if I do have a birth-related injury or trauma and something that I am having specific pain in, then great, I have this appointment set up and we can dive right into that care. And we did. And she experienced immediate relief. And so she came into that appointment feeling not ready at all to return to intimacy, to afterwards feeling like, wow, everything feels kind of, quote, back to normal, if you will. And so everything we do is on a very need by need basis. You will never feel pressured into doing an exam if you're not comfortable with that. You should never feel embarrassed to come in with pain points, tension points, or concerns. I was recently interviewed for a Catholic birthing podcast, and she asked me, why should a patient not feel embarrassed to come seek help? And I told her because I've been there. I have experienced leakage myself. I peed my pants like every cross country race in high school. And I was told that was because I was running hard and I was leaving it all out on the field. Now I know better. I know it's a sign of dysfunction. So even though I was having no pain, like no other symptoms, it was just peeing my pants with running, like that was a sign of muscle dysfunction, right? And that could have been retrained, just like we can retrain our hamstrings or our quads, right? So to just not feeling embarrassed, I've been there. I also have 4 kids, and my 4th was a home birth. I had 2 midwives. I had a birthing assistant and a doula in the room. And if you've ever given birth, like baby is coming out through our vaginal opening, right? Everybody sees everything. And so that like hesitancy kind of goes out the window, if you will, of just recognizing like, yes, this is a sacred space. It's also an area of the body that can and should receive support when medically needed, right? So childbirth is a beautiful example of that. Having a visit with your OBGYN is an example of that. And pelvic floor physical therapy is an example of that. In this most recent interview that I sat down with a Catholic doula, she also asked me, how I approach it from a Catholic standpoint. And we discussed that intimacy is such an important part of a marriage and that the pelvic floor is obviously a key area for that. And so to just not feel ashamed if you have questions, if you have concerns, if you're experiencing prolapse, it is a vulnerable area and it can feel really hard to talk about. And I want you to know that that's why we've created this space, because I felt like there wasn't a safe space to have these conversations when I was working in a sports med and an orthopedic practice. We didn't have private treatment rooms guaranteed. You could be out in the open clinic space where there are 40 other patients and PTs quickly moving about. And so when we're talking about pelvic floor rehabilitation, when we're talking about prenatal and postpartum physical therapy, when we're talking about pelvic floor health throughout all seasons of womanhood, whether you're a young athlete experiencing leakage, as I did, or if you're in the preconception, pregnancy, postpartum years, or perimenopause to menopause, right? We go through these unique life seasons where our pelvic floors have different needs. And our pelvic floor cannot just be isolated and removed from the rest of our body and only zeroed in on that, because there's some pelvic floor PTs who do that. They only focus on the pelvic floor. They only work internally on the pelvic floor. If you have outside issues, it's like, well, I'm focusing on the pelvic floor. Or you have orthopedic sports med PTs who are focused on every other area of the body, but the pelvic floor is like a black hole and they don't touch it, right? Or you have someone like myself and the PTs that I've hired onto my team, Dr. Ashley and Dr. Lauren, where we're looking globally at the body. We truly are doctors of physical therapy who are specialized in orthopedic and pelvic floor physical therapy. And I think it just gives this unique lens to evaluation and treatment of the pelvic floor to make it feel less scary, less embarrassing, less scary, really. I mean, I think there's a lot of fear women might place or hesitation around seeking out help if they have concerns in that region of their body. And so I just want to speak plainly about what you can expect in a session with us, what good pelvic floor physical therapy should look like, in my humble opinion. I have had patients come to us who have seen other pelvic floor PTs who are like, oh my goodness, this was so different than what I experienced elsewhere and what I expected. And just thank you. This was amazing. And that is the type of experience that we want to create. And so I do want to say too, if you've had a bad experience with a pelvic floor physical therapist in the past, to know that just like there's good and bad mechanics, right? Like there is good and bad everything, and that shouldn't write off the entire field, right? So give it another chance. If I'm local to you, I would love to see you in person. If you're in the state of Ohio, we would love to see you as a virtual client for physical therapy. And if you're beyond the state lines of Ohio, we would love to see you as a holistic pelvic wellness client, where we can just dive into your questions and concerns and individualized care for your needs, no matter where you're seeing us from. So I hope you found this episode helpful as to really what pelvic floor physical therapy is when we are taking a truly holistic approach. Again, I'm Dr. Kayla Borchers, and I would love to support you in any which way. So if you are like, yes, this is what I need, the link to our one-on-one booking is in the show notes. Again, it's myself and a team of doctors of physical therapy who are specialized in orthopedic and pelvic floor physical therapy, and we would love to support you. Until next time, take care and be